Hello, I'm Susan Baumgaertel, and welcome to Navigating Your Health with myMDadvocate, Episode 8. This is called I Feel Stuck with My Medical Issues. Well, boy, this is the end of the road. This is Episode 8, the final one, and I'm going to start with a quick recap of the previous episodes. So, Episode 1, if you remember, was I Can't Find a PCP, and I discussed the hurdles that make finding a new primary care physician challenging for so many patients. Episode 2 was What is my diagnosis? And I reviewed the complexities of finding a diagnosis, navigating the electronic medical record, and some of the challenges that arise with coordinating between multiple medical team members. Episode 3, if you might remember, was I Need Caregiver Support. And I dove deep into the layers of support needed for caregivers and explained my new acronym DAIS: Delegate, Ask, Identify, and Set Boundaries. So that was a good episode. Episode 4 was I Want to Age with Intent. I considered the various types of aging and shared my top 10 ways to age with intent. Episode 5, I Have Cancer, Now What? I talked about identifying personal needs early, having a multidisciplinary team, and shared a poignant poem from a cancer survivor. Episode 6, who could forget? Am I in menopause? I reviewed definitions of different menopausal stages, clarified how to understand the early signs of menopause, and gave some tips on what to pay attention to. And the last episode, number 7, was really a promo. It was called I Needed Help with Weight Management. And I gave an introduction to my full lecture from December of 2022 entitled What I've Learned from Running a Weight Management and Wellness Program for 7 years. So thinking about reasons you might feel stuck with your medical issues, and the list is probably endless, but I think some of the salient ones would be you have been getting care for a while with multiple doctors, and now they're coming and going or retiring, and lately you feel you're falling between the cracks. So that's a popular one. Maybe not popular, but frequent. Another one would be you're starting to question the medications you're taking and how best to treat your conditions. So kind of juggling about, are there alternatives, and maybe are all the medicines working together? Another one would be you need a fresh perspective and guidance on where to put your energy and effort. Sometimes fresh perspectives are really fresh and very helpful. Another one would be you may need to switch to a different medical system, but don't know if that's the right move. That seems pretty daunting, but is the case for actually many people. Sometimes that's insurance driven, sometimes that's just preference. And then, you really need advice on options and a best path forward from someone who knows the nuances of your individual situation and who will listen to what your needs really are. And I think that is really key. We all need to be listened to, right? So here's what I'm seeing a lot of lately. So I see many people frustrated just kind of beyond all get-go. They're frustrated by the systems. They're frustrated by access issues. They're not feeling human, and that is a big red flag. I see many people wasting so much time trying to get in touch with someone who cares. Again, system barricades at every turn. It could be a phone system, it could be an email system, it could be a triage system that really helps support the systems, but maybe not the patients. And I think that's the key. I see people actually angry at not getting in for a timely appointment with a specialist or even with their primary care physician, and then seeing someone else perhaps who might be good but doesn't know them. And that's that slippery slope, isn't it? I see many people overwhelmed with the insurance games. Not getting an important prescription refill or not getting procedures covered, that definitely pre-authorization process that both sides, actually, I don't think anybody likes. So why can't we change that? And, when it really comes down to the fundamentals, I see people who just want to be heard. They want to be seen. They want to be valued and supported. And we need to reclaim that big time, don't we? So let's just throw out 4 things that can help you reclaim control of your medical journey. This is not going to solve the entire list of woes, but it's a start, and it's a way to kind of feel like you can regain some control. Number 1, speak up, ask questions, be polite, but be firm. Be your own advocate. That is hard, I know, when you're sick or when you're afraid or when you're anxious. That's when a buddy, your advocate can be with you. That is important because, again, you can take charge of not getting lost in the system. Number 2, it's okay to change physicians if you have a choice. So not every doctor-patient relationship is ideal. That's just life, isn't it? So if it's not meeting your needs, it's not serving your health and your medical care, maybe it is time to switch. That can be hard, that can be daunting, but that's a reality. Number 3, don't get bogged down in the system. Find ways to communicate that make your medical needs met. You might need to ask how. How is the best way to reach you during office hours, after office hours? How is the best way to get my message heard? And if you're not getting a good answer, maybe rephrase that question. Don't just assume they don't care. Again, a lot of folks are overworked, and the staffing issues and just kind of the medical system is in crisis mode sometimes. But be persistent. Find out how you can ask your questions to get them answered in the way that you need. And number 4, look for physicians who practice evidence-based medicine. Yeah, avoid those snake oil quick fixes, and please ignore Dr. Google. That should be the first rule, right? So getting medical quality care is of utmost importance to all of us, and even more so when we're struggling with health issues. And I know that it's a time when many people feel vulnerable or dissatisfied or angry, but it's imperative that we get some control back and that we feel like we can be valued and cared for as patients, as humans, right? So access to competent, knowledgeable, experienced physicians, it's kind of getting harder and harder to come by, right? So those usual channels are not always working well. And I don't see any great solution on the horizon. Doesn't mean we can't spin it and reclaim it and feel valued and feel cared for. So I draw upon my 30 years of experience as a physician by offering health consultations, advocacy support, and medical coaching. And my service to you comes with caring expertise and purposeful collaboration. So let me know how I can help. I hope that all of us have access to that kind of care. It's really needed and it's really wanted. So I hope you enjoyed my series, Navigating Your Health with myMDadvocate. For more information, you can find me at myMDadvocate.com, and also access my free informational website, Menopause Menu, which is for all things menopause and aging. So that's it. I hope you enjoyed these series and have a great day.